Good evening to everyone and welcome to today's wonderful evening with Dr. Murli Bharadwaj. Every Friday and Saturday we have a subject-wise mock test and live discussion. I shared the PDF with all of you, and Monday to Thursday we have a particular subject revision of the single liners, which I call tweets, and I give you the tweet ebooks. So let's make the great beginning with this. So doctor, can you please punch as a voice loud and clear for all of you? Can you please punch? So today we'll take 200 questions in the pharmacology, which I have given to you as a subject-wise mock test for the NEETPG. So I hope you all solved the question paper, and now we are having a discussion on that. So let's start. A 28-year-old pregnant woman with abdominal pain and bleeding, she has taken a medication which caused the symptoms. Typically, what is that medication which caused the symptoms of abdominal pain? Right? She is taking a medication for the gastric ulcers. So you should remember, it is the misoprostol, question number 1. Misoprostol is the peptic ulcer disease medication which can lead to the development of abdominal pain as a side effect, is what you should remember. So because it is prostaglandin, and one of the side effects of it can be the abdominal pain. A 25-year-old seeks pregnancy termination, was given two medications. One of them is causing cramping and bleeding. Which medication which is used for abortion can cause cramping and bleeding? It is the mifepristone, which is known to lead to cramping and bleeding as one of the complications. A 45-year-old woman who has HER2 positive breast carcinoma is being given a targeted therapy. So what is that breast cancer medication which lead to development of, which is used for as a targeted therapy on HER2? So you should remember, it is the trastuzumab is what you have to basically remember. So I'll be going a little fast in the questions, so try to bear with me. So before the subject-wise mock test, I'll give you the PDF. You need to solve the PDF and join the discussion in the evening. I come back and we have a discussion. So now, doctor, a 32-year-old woman, she has a fishy smelling vaginal discharge and diagnosed with bacterial vaginosis. So what is the treatment of choice for bacterial vaginosis? You should know metronidazole is used for the treatment of the bacterial vaginosis. So NEETPG is an exam full of clinical vignettes. So you should know the clinical case scenario, either an investigation of choice, what is the next step in the diagnosis or the treatment that you want to do is going to be the way the examiner is going to quiz you in around 200 occasions in the NEETPG exam. So doctor, a 36-year-old woman with rheumatoid arthritis, she has got severe abdominal pain. She has a positive pregnancy test. So which medicine could be contributing? It is the misoprostol. Now, 24-year-old woman with cystic acne. So which acne drug can be teratogenic and you need to be careful when prescribing it? It is the isotretinoin among the acne drugs which is teratogenic. 30-year-old man who has painless penile ulcer, and the microscopy shows spirochetes, that is syphilis is your diagnosis. So what is the treatment of choice for the syphilis, doctor? It is the penicillin G, which is the treatment of the syphilis, which you should not forget. 62-year-old, 68-year-old who has got urinary symptoms, enlarged prostate, and which medication is appropriate for him to let the urine pass out and overcome the bladder outlet obstruction. It is the alpha blocker. Finasteride is the treatment for the bladder outlet obstruction, is what you have to remember. 28-year-old who has got dysuria, frequency, UTI, unprotected sex, which antibiotic is better for gonococcus? So you can use ciprofloxacin to treat the gonococci. 58-year-old with erectile dysfunction and no morning erections. So we need to use sildenafil is the drug of choice, which will typically increase the nitric oxide, which lead to vasodilatation and helps the corpus cavernosum to fill, is what you need to remember. A 29-year-old woman who is in labor with weak contractions. So what is the drug that we use to increase the contractility of the uterus, doctor? Oxytocin is the one which is being used. A 16-year-old male athlete using anabolic steroids, the muscular appearance, there is not much difference. There is no increase in the linear length in spite of taking anabolic steroid. So what is the cause for that? Because of the premature closure of the epiphyseal plates caused by the anabolic steroids. If you happen to give, there will be no further increase in the linear growth. So a 65-year-old who has erectile dysfunction is taking nitrates for angina. So what will happen if you happen to give sildenafil in this scenario to treat his erectile dysfunction? It will lead to severe hypotension, is what you have to remember. A 27-year-old woman with a painless vulvar ulcer and positive VDRL, what is the best treatment? So VDRL, which is positive, indicative of syphilis. Any given day for the syphilis, what is the treatment, doctor? You need to remember it is the benzathine penicillin, which is considered to be the treatment of choice. 65-year-old with urinary symptoms and enlarged prostate, diagnosed with BPH, then what is the first line treatment to treat him? So basically, to decrease the size of the prostate, we use finasteride, and to increase the flow, we use the alpha blocker, which is the tamsulosin, is what you need to. Tamsulosin is the one which you need to remember. A 30-year-old with chronic pelvic pain, ovarian cysts, suspected endometriosis. What is the treatment? So basically, we need to, all this endometriotic tissue is dependent on the action of the estrogen. So leuprolide is the one which we basically give, which is a gonadotropic releasing hormone. So that will cause the suppression of estrogen, which will help to treat the endometriosis, the mechanism of action, which you need to remember. Very good to see 16 online classmates. So every Friday and Saturday, we have this subject-wise mock test and discussion. And every Sunday, we have a full-scale grand test and discussion. Monday to Thursday, we discuss the subject. So at least 1 hour every day I spend with you. On the top of it, I'll give you 160 PDFs, which contain PYQs, single liner tweets of 65,000 tweets from 20 subjects called as tweet bank ebooks that you can download and also distribute. And I'll give you access to 1 year of video library access on this core learning app. On the top of it, to inspire you, I will be coming every day to spend time with you for 1 hour to discuss live, face to face. This digital TV is something like face to face kind of a class. So let's continue the discussion, doctor. So 29-year-old pregnant HIV positive woman is concerned about vertical transmission. So which antiretroviral drug is still given in the pregnant woman, doctor? So you should remember it is the zidovudine, which is considered to be safe and can be given in the pregnancy. 34-year-old with depression and tricyclic antidepressant overdose presents with tachycardia. And there is an altered mental status. So why there will be tachycardia? Whenever you give tricyclic antidepressant has got an anticholinergic effect. Acetylcholine slows the heart, anticholinergic speeds the heart. So that is the reason there is a development of tachycardia. That's the reason you need to obtain a ECG. 58-year-old with COPD exacerbation, a worsening shortness of breath, history of smoking, then which drug should be avoided? So you should know beta blockers. Beta blockers can lead to bronchospasm. That's the reason nadolol, atenolol, propranolol like drugs need to be carefully given. Whereas nebivolol is considered to be a relatively safer bronchodilator in the patients who are having the history of asthma. Nebivolol, please don't forget. So doctor, I hope all of you got the PDF of 200 questions on the subject-wise mock test. Be part of our WhatsApp study group. We will give you freely the PDF of the subject-wise mock test. Join the discussion after solving it. This session doesn't look this fast. A 65-year-old man with COPD on mechanical ventilation. He develops pneumonia, suspected to develop Pseudomonas aeruginosa. So what are the anti-pseudomonal penicillin? Piperacillin. Piperacillin tazobactam is considered to be anti-pseudomonal penicillin. Ceftazidime is considered to be the anti-pseudomonal cephalosporin is what you need to remember. 22-year-old man with cystic fibrosis and Pseudomonas aeruginosa infection, allergic to penicillin. Then what is the appropriate antibiotic? You need to give anti-pseudomonal beta-lactam plus aminoglycoside is considered to be the treatment of choice. Like you can take ceftazidime plus aminoglycoside is considered to be a good option whenever the patient is penicillin allergic is what you need to basically remember. A 34-year-old woman with asthma and wheezing after taking a medication. So there is something called aspirin-induced asthma. So aspirin can cause bronchoconstriction, and the development of the asthma is what you have to remember. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Please punch. Are you able to see the letters on the digital board clearly? Now, a 35-year-old who is HIV positive with pneumocystis jirovecii pneumonia and sulfur allergy is there. Because sulfur allergy is there, you cannot give the regular drug, which is trimethoprim sulfamethoxazole, doctor. Can you please punch? Is the voice loud and clear for all of you, please, those who are online? So that, I'm broadcasting from the home and sometimes internet is little oozy. Yeah. Now, so when sulfur allergy is there, where you cannot give trimethoprim sulfamethoxazole, still you can give aerosolized pentamidine is considered to be the drug of choice as a prophylaxis. A 10-year-old girl with bronchial asthma exacerbated by the cold air presents with the wheezing. So what is the best drug? So you should know albuterol, salbutamol, salmeterol. So they are all what? Beta-2 agonistic agents is the one which you can give. 28-year-old man with severe headache and shortness of breath, and after he has had a rapid descent to high altitude. So what is the treatment of mountain sickness? So typically we give acetazolamide, which is the carbonic anhydrase inhibitor, to treat the mountain sickness is what you need to remember. Now, doctor, a 7-year-old boy with asthma who has inhaled the corticosteroids develops a white coating. What else is needed? Oral candidiasis is a complication of taking the steroids, as all of you know very well. A 5-year-old girl with asthma using beclomethasone inhaler develops a white coating. Once more, even inhaled corticosteroids are known to lead to the development of the oral candidiasis. 67-year-old man with COPD and Pseudomonas aeruginosa infection with a worsening cough. What is the best treatment? So you should know among the penicillins, piperacillin tazobactam along with a aminoglycoside like gentamicin is considered to be the treatment of choice is what you should remember. A 24-year-old pregnant woman with placental abruption who is on medication for rheumatoid arthritis. Which medication likely contributes? So this we will take later. The frame of the question has an issue. So typically, patient with TB, 45-year-old is being treated with a 4-drug regime. So in that ethambutol is a part. In the question that I have given you, ethambutol was there, which is red-green color blindness is what you need to remember. 28-year-old women with steroids presents with fatigue, weight gain and hyperglycemia. So whenever you are giving steroids, the patient's going to iatrogenic Cushing syndrome is what you have to remember. 56-year-old woman who is taking etanercept for the rheumatoid arthritis presents with cough and cavitary lung disease. What is the important cause of a reactivated TB? So whenever you use any immunosuppressing agent like etanercept, then there is a reactivation of the TB, one of the complications. So every NEETPG they ask one question on monoclonal antibodies and their indications. A 65-year-old man who has got COPD, he is on albuterol, presents with muscle weakness. What is the next step in the management? Always remember, beta-2 agonists and insulin, what will they do? Beta-2 agonists and insulin, they push the potassium intracellularly into the cell. That is the reason there is a development of hypokalemia. So what is the most common cause of the hypokalemia in an intensive care unit? When you walk into the ICU, you see buzz, 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 buzz. All the nebulizers working. So all these nebulizers are pumping the beta-2 agonist, salbutamol, formoterol, penbuterol. So what will beta-2 agonist will do? They will push the potassium intracellularly, leading to the hypokalemia. Next day when the nurse comes, she will say, "Oh doctor, potassium is very low in this patient." So who is the one leading to the development of hypokalemia in intensive care unit? It is a beta-2 agonist, as the bronchodilators are the most common cause of the hypokalemia is what you have to basically remember. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Are you able to see the letters? So every Friday, Saturday, we have a subject-wise mock test and discussion. And Monday to Thursday, we have one subject. There are 65,000 short sentenced single-liner tweets like this. We'll have a discussion of that. And every Sunday, I'll give you a PDF of full-scale grand test. Solve it. Sit with a friend and solve it. Afternoon, 12 o'clock, we will have a discussion of the full-scale grand test. So this is going to be our 6 months journey together, and you are bound to win. I'll give you 160 PDFs to you. In that, there are 20 books which are called as tweet books on each subject. Each has got 3,000 to 4,000 high-yield facts in the form of short sentenced single-liner tweets which you need to master. So once you do that, automatically 6 months, every day, 1 hour you spend with me and revise these 160 PDFs that I give you, along with the mock test, every Sunday grand test, Saturday and Friday subject-wise mock test, automatically you will get the seat, doctor. Right? Everything good. Thank you, doctor. Now, a 68-year-old man with COPD, he uses ipratropium bromide. So what is ipratropium bromide? It is like atropine. So ipratropium bromide is a anticholinergic drug. What is the cause of the bronchospasm in the COPD patients? It is too much of acetylcholine action. High cholinergic activity in COPD patients is responsible for the bronchospasm. So how do you counter that? You counter that by giving an anticholinergic drug. So it is a muscarinic receptor antagonist, is the ipratropium bromide is what you have to basically remember. A 32-year-old who is HIV positive with pneumocystis, pneumonia. What is the first line of treatment? Always trimethoprim sulfamethoxazole, Bactrim double strength is what you give. If there is any sulfa allergy, then you will be giving typically, wherever there is any sulfa allergy, pentamidine is the one which is being given. 45-year-old with a history of the TB exposure presents with the hemoptysis and cavitary lung lesion. What is the first line treatment, doctor? Always. Isoniazid is the most powerful of all. Rifampicin, INH. They should be part of every regime. 28-year-old with asthma who is on cromolyn sodium. So he presents with toluene blue stained cells. So what are they? Mast cells. So mechanism of the cromolyn sodium is to inhibit the degranulation. Degranulation of the mast cells is what you have to basically remember. 35-year-old HIV positive who has got meningitis with capsulated yeast cells. So, bacho, what are those capsulated yeast cells, doctor? So, capsulated yeast cells are cryptococci, neoformans. So, you need to treat it by giving IV liposomal amphotericin B plus flucytosine followed by fluconazole is considered to be the treatment of choice. 67-year-old comes to the OPD with a rust-colored sputum and he has got a lobar consolidation. So for the lobar pneumonia, how do you treat, doctor? What is the drug of choice? It is the azithromycin. Azithromycin plus ceftriaxone is considered to be the treatment for the lobar pneumonia. 58-year-old man with CKD who has got pyelonephritis with elevated creatinine. So all the aminoglycosides are nephrotoxic. Gentamicin you need to be careful to give to a patient who already has got a high creatinine levels is what you have to remember. 25-year-old woman who has got a persistent asthma is started on albuterol. To the albuterol, which is a beta-2 agonistic agent, what else you need to add? Among the asthma medications, all of you know, montelukast and levocetirizine come together. So we add montelukast is what you have to understand. A 65-year-old is on amiodarone. Amiodarone is used for atrial fibrillation. So all the side effects of amiodarone you should know. Amiodarone can cause skin pigmentation. Amiodarone can cause corneal deposits, which is called cornea verticillata. Okay. Amiodarone can lead to pulmonary fibrosis. That's the reason always any patient who is on amiodarone for atrial fibrillation, tomorrow as a cardiologist, you need to ask them to undergo PFT, pulmonary function test. So pulmonary fibrosis can be caused by the amiodarone is what you have to remember. A 30-year-old male with TB contacts, started on a 4-drug regime, should be prescribed which vitamin? So all of you know, INH can lead to peripheral neuropathy. To prevent that, we give pyridoxine, vitamin B6. Easy question, right? So tomorrow NEETPG also will be very easy, provided you know what are the standard stock questions examiner is going to ask. A 10-year-old boy with asthma presents with wheezing after playing saucer. What is the most appropriate treatment? Always remember, exercise-induced asthma, nocturnal asthma, we give salmeterol. What is salmeterol? Salmeterol is called LABA. That is long-acting beta-2 agonist. Salbutamol is SABA. Short-acting beta-2 agonist is what you need to basically remember. Now, a 34-year-old IV drug user, suspected pneumocystis, trimethoprim sulfamethoxazole is the treatment of choice. 45-year-old diabetic with oral thrush because of the inhaled steroids. To treat the candidiasis, we give nystatin is the treatment of choice. 40-year-old who has got asthma, which is poorly controlled asthma, you want to give a drug which will inhibit the production of the leukotrienes. It is the Gilutan is what you need to remember. 28-year-old came unconscious due to carbon monoxide poisoning. What is the very important thing that you need to do? You need to give 100% oxygen. 100% oxygen dena bite with non-rebreathable mask is what you have to remember. So 52-year-old with isoniazid, once more the same question, vitamin B6 need to be given. 32-year-old with well-controlled asthma, you want to control the nocturnal symptoms, night time. Then you need to give a long-acting beta-2 agonist, which is salmeterol, bhulna nahi. So asthma, Parkinsonism, migraine, these are all very standard topics in the pharmacology, which you need to be very sure about, doctor. A 45-year-old man on TB treatment developed joint pain, muscle aches, and malar rash. Malar rash is a drug-induced lupus, which is the thing among anti-tubercular drugs. Do you remember? Isoniazid can lead to the development of the drug-induced lupus is what you have to remember, doctor. 28-year-old woman with asthma who is on theophylline presents with seizures and metabolic disturbance and metabolic disturbances. She's on theophylline. So all the drug interactions of the theophylline, you need to remember, right, doctor? Now, let's quickly move on. A 5-year-old boy with persistent cough after upper respiratory infection. What is the best cough suppressant? Because it is only upper respiratory infection. Earlier days, link test in the pediatric age group we used to give, but currently link test is not permitted in India. 65-year-old man with emidaron presents with a new onset hypothyroidism. What thyroid conditions it can lead to? Emidaron can cause both the hypothyroidism and also hyperthyroidism. That is what you need to remember. 57-year-old man with ischemic heart disease asks about sildenafil. So ischemic heart disease, if you are using nicorandil is also causing nitrates to release. Sildenafil also works on nitrates. दोनों nitrate add हो गया तो क्या होगा? Severe hypotension hoga. That's what you need to remember. 54-year-old obese man with type 2 diabetes is prescribed metformin. So what is the best way? Appropriate initial prescription. Metformin 500 milligrams with food for 14 days. Then metformin 500 mg BD for 14 days and then come for the review. That is what you tell to the patient. 45-year-old woman who has got rheumatoid arthritis is starting methotrexate. Always whenever methotrexate is started, be very sure, monitor liver function tests. Liver function tests. Any rise in the liver enzymes. Similarly, blood count. Because you want to look for any megaloblastic changes. So these are very, very important. 64-year-old man with heart failure who is on lisinopril, bisoprolol, and furosemide. Right? So he's on lisinopril, eslimida, furosemide, bisoprolol. Then which antihypertensive is contraindicated? So always remember, calcium channel blockers, beta blockers, you need to be very careful. Whenever your patient is having the heart failure which is not improving, then always look for his medication history. Calcium channel blocker, if it is there in that is a culprit which you need to treat, which you need to remove, is what you need to remember. 59-year-old man with diabetes, AF and epilepsy reports blue tinged vision. Blue tinged vision. Sildenafil nitrates, one of the important complication is development of blue tinged vision. So where do you get yellow vision? Digoxin is the drug which leads to the development of the yellow vision is what you should understand. A 62-year-old woman with hypertension, angina on multiple medications. Right? So you need to give modified release calcium channel blockers as a add-on drug in hypertension and angina. 45-year-old on paroxetine, clozapine and carbamazepine for bipolar disorder. So in this carbamazepine is also one of the indications is other than anti-epileptic, it is also used in the bipolar disorder. 38-year-old women on lithium therapy. When do you want to take the blood sample for the monitoring of the drug levels of the lithium after you give it? So you should know what is the volume of distribution, what is the half-life, what is the therapeutic dosage, what is the toxic dosage, everything about lithium. You need to be sure doctor very commonly given drug. So 12 hours after the last dose, you need to send the sample for the therapeutic levels is what you need to remember. 62-year-old man on metformin for diabetes develops a persistent diarrhea. So one of the effects of the metformin in few people, not all, few people, it can lead to diarrhea. So that is the reason, doctor, start modified release metformin 500 mg once daily, OD, with the evening meal is considered the way to beat the diarrhea caused by the metformin is what you need to remember. 74-year-old women with hyperthyroidism, atrial fibrillation, and a low TSH level. That means hyperthyroidism is there. Epiduron is the underlying cause. 36-year-old woman with ulcerative colitis on mesalazine. Mesalazine is the sulfur drug which is used for the treatment of ulcerative colitis. 49-year-old women with menopausal symptoms with a family history of DVT. So, what are the most suitable hormone replacement therapy? We deliver the hormone replacement therapy as a transdermal combined sequential preparation is a better format in the patients who are having the history of DVT. 80-year-old man on lithium therapy with elevated BP. If someone is on lithium therapy, you need to be very sure on the various drug interactions, and amlodipine is considered to be a good choice for calcium channel blocker. 79-year-old with heart failure and COPD reports yellow tinting of the vision. So yellow vision, as I told you, is one of the side effects of digoxin, is what you should understand. 67-year-old with urinary symptoms, hypertension, presents for evaluation. So, what is the indication for the alpha blocker? Alpha blockers are given for hypertension plus benign prostatic hyperplasia, because alpha blockers like prazosin, which are used in hypertension, generally useless, because in long run prazosin is not going to alter the prognosis or improve the prognosis or improve the mortality, but still in a hypertensive we still give prazosin. Two situations. One is whenever the BP is so high, not easily controllable with beta blockers, ACE inhibitors, that is one scenario. Second is whenever there is any BPH, just like tamsulosin, prazosin also can help not only for the hypertension but also for the BPH, is what you need to remember. A 42-year-old man with pulmonary TB started on 4-drug regime. What is very important investigation you need to do, doctor? All of us know. Anti-tubercular therapy induced liver failure, poorest prognosis. I have not seen a single case in my lifetime. In the past 30 years as a MD general medicine physician, any patient improving with liver failure due to the anti-tubercular therapy. That's the reason you need to do LFT whenever the patient is having the taking the ATT. 78-year-old women with osteoporosis cannot tolerate alendronate. So what is the best treatment, doctor? Risedronate, the big brother of alendronate, is the one which has been given. But today we are all in the days of denosumab, which is a monoclonal antibody that inhibits the osteoclastic activity. Denosumab is the one which is used to treat the osteoporosis. One injection subcutaneously every 6 months, 60 milligrams injection. That is what we give in the modern era. 55-year-old man on cyclosporin therapy presents with liver injury. So what is the most important side effect of cyclosporin, doctor? Hepatotoxicity and cyclosporin. Please don't forget. 25-year-old pregnant woman with acne vulgaris seeks for a safe treatment. So don't give systemic retinoids, rather give, because they are teratogenic. So try to give topical isotretinoin is considered to be the treatment. 45-year-old man with epilepsy, psychiatric disorder, presents with confusion, tremor, and a seizure. What are the most likely diagnosis, doctor? Lithium toxicity, all the symptoms. Therapeutic dosage, toxic dosage of the lithium, you need to be 100% sure for the tomorrow's NEETPG exam. 58-year-old with type 2 diabetes started on sulfonylurea. So how do sulfonylureas work? How do sitagliptin, vildagliptin, all the gliptins act? Empagliflozin, dapagliflozin, all the glyphosins act. You need to be very sure on the mechanism of action of all these oral hypoglycemic agents is one of the favorite topic of the examiner doctor. So, the sulfonylureas, what are the first generation? Glyclazide. Second generation, glibenclamide. Third generation, glimepiride. So today we are all using 1 milligram BD, 2 milligrams BD, but sulfonylureas go and release the endogenous insulin, and the patient can go into hypoglycemia, which you need to be very sure about. A 45-year-old woman with asthma, with migraine, experiences palpitations and tremors. So, which asthma medication? Always beta-2 agonists are known to lead to development of tremor. Is one of the side effects of the salbutamol like drugs is what you should remember. 21-year-old presents with confusion, headache, lives in a poorly ventilated house. What are the most likely diagnosis? So, poorly ventilated house, crowded scenarios in a slum area, you need to think of carbon monoxide poisoning. A 65-year-old with type 2 diabetes on metformin has a creatinine level checked. What threshold should metformin dose be adjusted to? So you should know it is 130 micromoles per liter. Micromoles per liter. Then 57-year-old scheduled for a CT scan with contrast is on metformin. What are the most important thing about this, doctor? Always any diabetic patient to whom you are giving contrast who already has a risk factor of a raised creatinine should be withheld metformin and need to be restarted only after 48 hours is what you need to remember. A 32-year-old male with cocaine toxicity presents with hyperthermia, mydriasis, elevated CK. So you should know what are all the side effects of cocaine toxicity. What happens to respiratory rate? Will it be respiratory alkalosis or metabolic alkalosis? Metabolic alkalosis doesn't occur because metabolic alkalosis occur only in two scenarios. When will metabolic alkalosis occur, doctor? You need to be very sure. Yeah. So when will metabolic alkalosis occur? So high aldosterone, please don't forget. What will high aldosterone will lead to? High aldosterone will cause sodium retention, loss of K plus and loss of H plus. Loss of K plus, loss of H plus, and retention of sodium. So loss of H plus lead to development of metabolic alkalosis. Now the question is, what lead to a high aldosterone? It can be primary hyperaldosteronism, it can be secondary hyperaldosteronism. Primary hyperaldosterone occur whenever primary hyperaldosteronism, whenever there is any adrenal adenoma, Conn syndrome. Secondary hyperaldosteronism means typically whenever you are dehydrated, it leads to a decreased renal flow, and that will cause release of renin. Renin causes increase of angiotensin increases aldosterone. So dehydration is called secondary hyperaldosteronism. Conn syndrome is called primary hyperaldosteronism. This is what you need to basically remember. So doctor, with this, we call it a day. Enjoy your preparation with Dr. Murali Bharadwaj. You don't require costly plan A's, plan B's, plan C's, plan Z's, or ratta karo, batti karo kind of sessions. logically approach the subject. I'll give you 65,000 high yield facts as single liners in 20 tweet books. Okay. Then 75 full scale grant tests for you to practice, 50 subject wise mock tests for you to practice, 400 hours of video content on the Score Learning app, and I spend with you at least 1 hour every day to inspire you to consume these contents. Every Sunday we have a grant test discussion. Every Friday and Saturday we have a subject-wise test discussion. Monday to Thursday we'll have a particular subjects, the tweet single liner book based on the PYQs. We will have a revision. 6 months be with me, and I assure you that you are going to be the topper in the NEETPG. Good night and enjoy your preparation.